We're joined now by Kathy Huff, who's a nurse with Methodist Hospice. Kathy, welcome today.
Thank you.
I'm so pleased that you joined us because we've heard from administrators, we've heard from family members that advance directive is important, but I wanted you to touch back on your clinical experience as a nurse and tell me what it's like to take care of patients when there is, let's say, a clinical crisis or a decision to be made and no advance directive is in place. Tell me what that feels like as a clinician at the bedside.
Well, it happens more often than not. I have worked in the emergency room and on the floor where I've taken care of very sick patients. And when they get into a crisis and we have an advance directive, we just move forward. But many times we don't have that. And if it's in the middle of the night, there's no family at the bedside, or the family is under a lot of stress, and you're trying to give them their options and help them make quick decisions in crisis. It's very, very difficult and frustrating. As a clinician, you want to advocate for the patient and do what the patient wants. And many times families will ask you, well, what would you do for if it were your mother?
Right.
And what I would do for my mother may be very different from what their mother may want them to do. So having the advance directive really helps guide that, where you can move to the actual care and provide that. And we spend a lot of time making decisions, and sometimes we lose a lot of time, and that's very frustrating.
So you mentioned frustration. What are some of the other emotions that you've felt as a caregiver as you're trying to help this patient, but you want to advocate for them, and something's about to happen that you think they might not want, yet you feel obligated by hospital policy or even healthcare law to do if you can't find out what the patient would want or what the family's requests are? How did that make you feel as a clinician? Besides frustrated, what are some of the other emotions that you felt?
Well, you feel a lot of fear, and you carry that home with you. You know, many times you go home, and before you put your head on your pillow, your mind is racing through the day of the care that you've provided to patients, and you wonder if you made the right decisions. And I know family members many times feel the same way, but there is a lot of fear involved when you want to advocate for a patient and provide the care and do the right thing.
Yeah.
And you know what the right thing for you would be, but not necessarily for that patient.
You talked about fear that you feel and fear that the families feel. Are there other emotions that you've picked up from families in those midnight calls where you're saying, you know, Mr. Jones is having trouble, what do you want us to do for Mr. Jones? What are the emotions that you pick up from family members when they're being squeezed into a crisis mode with decision making?
A lot of confusion.
Okay.
They typically are asking for someone else to make the decision for them many, many times because they don't have maybe the medical background or the education, and they don't understand, and it becomes very confusing for them, and which makes it very confusing for the whole situation. It becomes a big tornado that everybody gets in trying to take care of the patient and making decisions, and you're calling physicians and you're calling family and you're actually trying to care for the patient. And it becomes, like I said, a huge tornado, and at the end, you're not sure whether the outcome would have been different had you known what they wanted.
Absolutely. You know, you and I are parents, and we often tell our children good things don't happen after midnight in terms of them staying out. Is it fair to say that good decisions often don't happen after midnight, that we should have advance directive conversations before the crisis comes?
Absolutely. I mean, we don't typically make our decisions from 8 to 5 when there's a crisis. You know, when I worked in the emergency room, many people came and said, I don't have time for this. You know, I'm supposed to be at home sleeping. I have to be at work in the morning. We don't get to plan our emergencies. We don't get to plan a lot of things that happen in our life. And this is an opportunity where we can do advanced planning so that the decisions are made and we don't have to get into that big ball of confusion at the end.
It's preventable, isn't it? There are tools that can help us and our families
Absolutely.
To make good decisions when things are calm and there's plenty of time for discussion.
Absolutely.
I see that you've brought with you today the 5 wishes document. We've mentioned that earlier. Would you just walk us through what those 5 wishes are and how this document helps families? What's wish number 1?
Wish number 1 is, and they're written on the front, the person that I want to make the decisions for me.
This is a very critical one, right? So this takes effect if I as a patient can't speak for myself, who's going to speak for me. It's called a healthcare proxy.
Absolutely.
And that's wish one.
Right, and there are second and third choices as well. So if you put in the one person that you want, you can also put in a second person and a third person if that person's not available.
So the healthcare clinicians would then go down the order. I want my wife to speak if she's available. If she is incapacitated for whatever reason or cannot be reached, then it'd be my son. Or for instance, and it just goes down the line. This eliminates a lot of confusion, right? Because often in a large family, some of the controversy is who's to speak now.
Who's responsible? And it may not even be a family member. I know for myself, I have a friend who is a nurse herself and who can make good healthcare decisions because my husband said he didn't want to do that.
And so you relieve that pressure
That's
for your
right.
husband by naming her as your healthcare proxy or decision maker.
That's right.
What's wish number two?
Wish number two is the kind of treatment that you want and don't want. I know many times people hear I want to be a DNR or not to be a DNR, and there's more choices than that.
Now this refers to resuscitation attempts like shocking the heart or doing the chest compressions, resuscitation with a bag or mouth to mouth.
Right, and not only that, but it can even go into feeding, tube feedings, things like that.
IV fluids.
IV fluids.
Antibiotics.
Anything that you might want or that you don't want.
Okay.
And you can list those out almost in a conversation type way.
Okay. And so it's a menu, isn't it? It isn't just one or all. You can choose different options that you'd like and talk about that with your doctor.
Right.
The third wish?
The third wish is how comfortable do I want to be? And that refers to pain management. Many times people will say, keep me comfortable. Some people will say, I want to be comfortable, but I want to be awake. There are different ways to remain comfortable. I want to be kept clean and dry. Okay. Those type things. So it refers to the comfort level that you want.
And the fourth wish?
The fourth wish is how I want people to treat me. And this goes from everything from, do I want someone sitting and holding my hand? Do I want someone to play music?
Sometimes people want their space.
Mine says do not play music. So, sometimes you may want candles in the room. You may want the television on. Some people really like to have the television on. So, how do I want to be treated? Do I want a lot of people there? Do I want just my immediate family there?
So you can really paint a picture of how you want your health care to look, even if you're not able to speak for yourself.
Right.
Tell us the final wish.
The final wish is what I want my loved ones to know.
Okay.
And this is an area where you can put anything you want people to know and maybe carry with them after you're gone. You can put notes of forgiveness. You can even put, how you want your final services to look, how you want to be remembered, those type things where you can put in. And families really like to have that afterwards to look back and see that they have done everything they've done that you wanted.
As you're listing these wishes, Kathy, I'm struck that advanced care planning in the 5 wishes format is really not just about what kind of care we don't want. It's certainly not about cost savings. It's really about positive things of how we want to be remembered, what we want our life legacy to be. And so although it's about the way we die, advanced care planning is also about the way we live and what we want that meaning to be. I'd like to encourage our viewership to know that the 5 Wishes document is available. You can either search it on your internet search engine as 5 Wishes, or you can look under the Aging with Dignity website. What would you say is the most important element of an advanced care directive in terms of what it gives a family from your clinical experience?
It gives them a sense of comfort, especially after the person has died, to know that they have done what they wanted. I know it's been a huge helpful tool in hospice.
Absolutely.
To enhance the care that's being provided so that we know that we're being guided by that patient's wishes. And when that patient passes on, the family takes away a sense of comfort instead of that sense of, I hope we did what they wanted. It's, I know we did what they wanted.
Wow. What a wonderful gift to give to ourselves, our families, and our caregivers. Thank you, Kathy.
Thank you.
We've been joined today by healthcare administrators by a family member, and by a practicing clinician, all of them have told us the same element of advanced care planning. It offers comfort, hope, and clarity, not only to patients and family members, but to healthcare clinicians as well. Join me in taking this positive step to empower yourself and your family to achieve what you desire from your healthcare team. Thank you.
Hospice's Hope was sponsored by Methodist Hospice, where the end of life doesn't have to mean the end of living. In the face of life-limiting illness, Methodist Hospice provides comprehensive care and compassion to patients and their families. Methodist Hospice helps patients to retain their dignity while also focusing on their social, emotional, and spiritual needs. More information can be found at www.methodisthealth.org or 901-516-1600. Methodist Healthcare, embracing the miracle of life.